Hello, my name is Emily Soto. I've been a therapist for 21 years, and today I'd like to go over some common draping mistakes and how to fix them. Also, I want to show some of my favorite sports therapeutic massage techniques. To start things off, you want your client to feel comfortable, warm, and safe. When you're going to uncover the lower back, what I like to do and let's start with what I don't like to feel or see. What I don't like is a therapist that's poking around my lower back, trying to see where my undergarments are or my shorts or if I'm even wearing any. So when I start the massage off, I do some dry pressure massage. One, it helps me figure out where their muscle tension is and where the areas I'm concerned, how they feel. And then also I can feel in their lower back by just doing closed hand compression and to see where their undergarments are, if they're wearing shorts or if they're not wearing anything at all. And once I figure that out, I just go to the bottom and corners and tuck the sheet in and pull the sheet back. It was quick, it was swift, and the client still feels safe. And to bring it back, you just pull the sheet over to the top of the table and fold back. To undrape the arms when they're laying on their prone position, you want to just fold it. I like to hold it here at the top of their shoulder and fold it in triangles. Once enough of their arm is exposed, with my left hand, I just bring their arm out, and with my right, I pull the sheet to the top of the table tightly so that they feel secure. And this will also give me the ability to be able to stretch without them feeling uncomfortable, move their arm around, pull, and nothing's going to be exposed. Now to bring the arm back under the sheet, all I do is bring the arm over to the top of the table, bring the sheet over a bit, lift the sheet up a little bit, and just bring their arm under the table quickly. Now let's move over to the legs. Pretty much same thing as I did in the arm. I like to bring the sheet over in triangles to the top of their knee. With my left, I pick up the leg under the knee, and then with my right arm, I pull the sheet towards their hip. And if I need extra room to work on towards the top of the leg, I just roll the sheet on over to the top of their hip bone and tuck underneath. If the client is new or you feel like there's some hesitation, sometimes what I do is have them hold the sheet themselves. I like to tuck it because sometimes they forget to hold it or whatever and it comes undone, but I feel tucking is the easiest and most effective. Now to bring the leg back under the sheet, same thing, you want to be quick and swift. So again, you want to hold with your left hand right under the knee, lift up, bring the sheet over with the right hand, and just pull it to where they're fully covered. Now, where I see most mistakes or when clients feel the most uncomfortable is when they're going to flip over. Sometimes, especially as a woman, you feel a little bit uncomfortable if you don't know the therapist or you just don't know what's going on in the room at that time because one, you've been face down for a long period, and two, this is a new environment for you. Some therapists like to hold the sheet up top and have the client scoot down and flip. And that can be effective, but depending on the size of the client, they can get tangled in the sheets and expose themselves by mistake. Another thing I see is therapists holding the sheet up like a tent, like this, and same thing, depending on the size of the client, they can get tangled, raveled in the sheet, and they can get exposed without wanting to. So I feel like the most effective way to have somebody flip on their back from the prone position is to hold the sheet at its ends here and lift the sheet up. That way it gives them ample room to scoot down, flip over, and nothing will be exposed. Another thing, you want this side of the sheet to be, you want to press your body against it so that way it's tight and it will not come undone. So the client will feel nice and safe. Okay, now we're gonna go ahead and start our massage. Okay, so just to tell you a little bit about my client here, her focus today are both her hips and her right leg. So I'm going to spend a little bit of time warming up her hips. In my sports therapeutic sessions, I like to offer a full body massage, but I always tell them sometimes when you have areas of focus, it might not feel, or it may not give me enough time to provide a full body massage. But I do guarantee that the areas of concern are going to be what we're going to focus on. If they prefer a full body massage, then that is a good time to offer adding on more time. It's an easy way to upsell your client from a 60-minute to a 90-minute, or sometimes even 2 hours if you're okay with having a client on the table for 2 hours. Is the pressure okay? Yeah. this kind of session, I like to offer cupping and scraping. And keep in mind that when you're warming up the muscles like this, before you add those tools, it's a good way for you to feel how the muscles are tensing up, if the hips are height, which side is working more than the other. Sometimes asking the client beforehand about their lifestyle, their type of work that they do on a daily basis, if they work out, if they're active, if they're not active, will also give you a better understanding of how to work with your clients on the table. Now that we've warmed up the area for a good 5 minutes or so, we're gonna go ahead and add some scraping and some cupping. This side's been hurting Madeline a little bit more than the other. And I can tell because she kind of tensed up her legs a little bit. So this is a good indication for you to ask your client, is the pressure okay? Pressure's okay. All right, and keep going. When I use cupping or scraping in my massage sessions, I like to start off by scraping and then adding the cups on. When it comes to scraping tools, it really just depends, one, on the area that you're working on and what feels comfortable in your hands. To me, in this area, I like to use this one because it's kind of easier for me to hold. And also, it gives you a better angle of the area that you're working on here at the hips. And this is just to get the circulation going, break up some adhesions, maybe some scar tissue that she might have in here. Aside from being a massage therapist, Madeline works out 3 to 4 days a week, sometimes maybe more. She has a pretty busy schedule, so I know her back feels it. And with scraping, you don't have to leave so much redness behind. You don't have to go by what you see on social media. Sometimes I feel like it's a little bit much, but choice your own. Sometimes to me, less is more. Out, I felt some tension areas around here. So with the cup, you can also do scraping, especially with the silicone cups. These are much easier to glide with when you're trying to do a massage. And just leave them in the areas that feel needed the most. I really enjoy using the silicone cups when I'm gonna stretch the client because they're easier to move with. Sometimes the vacuum cups or the plastic cups, they come off or they're too tight. So I'm gonna undrape her lower leg so I can get some stretches done. Again, picking up with the right. And with my left, I'm gonna pull towards the hip. This is called active cupping because the cups are on and you're having the client stretch and move with them. I love this technique, especially for my athletes. Sometimes I'll have them do, like for example, if I have a soccer player here whose adductors are acting up, I'll put the cups on him or on his legs or on his adductors, and I have him do some of his dynamic warm-up movements. Sometimes I'll have him kick or do lunges or squats. And it really helps to loosen up some of those muscles. Another thing to note is when you want clients' feedback, they don't always have to verbalize that they're in pain for you to know that maybe you're going a little bit too deep. If I feel that Madeline's tensing up her back, or like, I don't know, like lifting up her legs a little bit, squirming, that's a clear indication that maybe your pressure is too much. Off. Okay, so Madeline's been feeling some tightness in her legs. She expressed that whenever she squats, she feels pain behind her knee, around her hamstring and upper calf, and asked if I could please do some scraping. This area is very sensitive when it comes to scraping, when it comes to massage. Here you have to be extra vigilant of your client's body language and ask along the way how the pressure's doing. Madeline's pretty good about letting you know if it's too deep. But then again, she's comfortable with me. You know, we've known each other for a long time. Right there, she just moved her leg. That lets me know that I found a spot that's a little bit too deep. So I'm gonna back up, bring my pressure down a little bit, and change my technique a bit. Maybe start off doing scraping more with my knuckles before I introduce tools. There we go. This area of the body, I like to use this tool because it has a bigger groove, so it latches on to the hamstring easier. When it comes to the IT band, I typically am not a fan of going really deep in this area here. I feel that if we focus on the insertion points and loosen that up, work that out, that typically tends to help the IT band pressure lessen. And remember, we also already worked up at the hip. We already worked this area up here. We loosened it up too. I always tell my clients that when they're foam rolling or using a lacrosse ball to focus more on those insertion points, like the glute and the upper half of the knee, the bottom half of the hamstring. They'll get better results, and it'll hurt, but not as much as that IT band. right here. There we go. Here's a good time to do some stretching. I like to lift up the leg, put their knee up on my hip, and bring their leg down like this. Again, with the cups on, it'll increase some of the pressure. And the client will feel that stretch a little bit more. After I take off the person's cups, I always like to go over and do some effleurage. Get that blood moving.